Okay, so the first thing we're going to do to try to get to those goals and those outcomes is to submit a budget change proposal for the following staff. We definitely need two discharge planning nurses. So whether or not that's going to be two registered nurses or one RN and one LVN, that's okay because this is backed by the patient care volume and trended data. Again, the volume, 150 patients are paroling per month, and the trended data has to do with the fact that we do see there are variables that are causing dates to change, which results in nurses having to prioritize those patients that are paroling early, right? So not a consistent timeline, so we do need to take all those variables into account. Sorry. We do need to see whether or not our medical LCSW for social services and care coordination needs uh, can take a heavier workload. Currently, they are only conducting the NIDA modified assist to assess as to whether or not a patient should be referred for MAT and CBI within the incarcerated population, within our treatment services. But we're definitely evaluating whether or not we can increase some criteria for this social worker to do care coordination as well for this discharging population. We need to definitely develop an updated flow map for the RN who's discharging these patients, considering there are timelines and activities that need to occur based on the 45, 30-day, and 14-day timeline. So that flow map definitely needs to be updated. The existing flow map starts at 90 days, which is not useful. There's not enough information. There's not enough research that is done for the patient transitioning to the community yet. We do rely on our parole agents to conduct a lot of that research, and it's not done at 90. So we do need to update the flow map and make it very consistent for the process. We also need to update the flow map in terms of what will the nurses do, the two nurses assigned, when the dates do change from, for example, from 60 days to 14 days. So we'll talk more about that as well. Um, we'll update the flow map for that as well. Um, Additionally, the um, the consistency of making sure that a 30-day visit is done in person and that the logistical information is already in the chart and ready to go so that we can begin the process of linking them to an outside provider. That has to happen. And that can be done within our flow map, support, and extra staffing. Additionally, the last step in the process is to make sure that at the 7 to 14 days prior to paroling, the entire appointment plan is complete. All appointments are confirmed. The education and any final needs are addressed with the patient. So again, these will be the resources and contributions in summary. Um, Budget change proposal, updating the flow map, uh, updating the steps necessary within the parole process, and um, clearly discussing what the process is for those patients who are changing timelines and not giving us the necessary um, time to get all activities done. So we do need to make sure that those patients are prioritized and that there is a specific process for that as well.